Hey guys, welcome back to my channel, the best place for answers to all your women's health concerns. I'm Dr. Tiffany Woodus, your South Dallas Pelvic MD. We have a combination OBGYN question this week and it reads, Hey doc, what advice would you give to someone to help them prepare for pregnancy? Such an important topic. By the way, if you have a question you'd like to see us address on this channel, be sure and drop it in the comments below. Let's get into it. Optimizing preconception care is a crucial and often overlooked strategy for improving Black maternal health outcomes. It essentially affords us the invaluable opportunity to elevate your health and well-being pre-pregnancy. Preconception care gives us an opportunity to tackle and improve control of chronic medical conditions such as obesity, hypertension, and diabetes. It provides us an opportunity to assess social determinants of health, such as access to healthy food, clean drinking water, safe neighborhoods, reliable transportation, all key factors that can impact pregnancy outcomes. Preconception care affords us the opportunity to evaluate for risk factors and the chance to come up with a strategy for prevention and surveillance of those risks. As we previously discussed, Black women are 2 to 3 times more likely to experience an unintended pregnancy due to factors like differential access to contraceptive counseling. This obviously completely cuts us off from all the potential benefits of preconception care. We can change the narrative and do better than this. Here's what I want you to know about preparing for pregnancy. Number 1, consider whether your current lifestyle supports a healthy pregnancy. Take this opportunity to optimize your health prior to pregnancy to increase your chances of a good outcome. Prioritize a healthy diet, regular exercise, managing stress. It's important to avoid alcohol, illegal drugs, and toxic substances. If you smoke, make and execute a plan to quit. If you are at risk for sexually transmitted infections, consider screening for yourself and for your partner. Check your vaccine status. Make sure that you are up to date, ideally at least 1 month before you are trying to conceive. Number 2, consider your birth control method. In general, if you are using birth control pills, the ring, the patch, progesterone IUDs, or Nexplanon, your ability to conceive returns rapidly after stopping these methods. You can also expect your period to return usually within 30 days of stopping these methods as well. If you are using Depo-Provera, your return to fertility may take a little longer. In general, there is no prescribed period of time that we recommend stopping these methods prior to trying to conceive. However, giving yourself a break does allow for some normalization of the menstrual cycle, which is a key step in helping you understand your fertility window. Number 3, address any chronic medical conditions. If you have conditions like diabetes, hypertension, asthma, weight issues, sit down with your provider and make a plan to optimize these conditions prior to conceiving. Do not stop or make any medication adjustments prior to addressing it with your provider. Depending on what you're taking, your provider may suggest changing the dose, switching to a different medication, or stopping the medication altogether. Speaking of medications, now is the time to start taking a prenatal vitamin with folic acid, iron, and DHA. These supplements are important for fetal, brain, and neurologic development, as well as the prevention of anemia. Most people don't realize prenatal vitamins are the most effective when started prior to pregnancy. Number 4, start a menstrual calendar. This will allow you to get a good understanding of the menstrual cycle so that you can begin to understand when you ovulate, your fertility window. We consider a normal menstrual cycle to be anywhere from 25 to 35 days in between cycles, from day 1 to day 1 of bleeding, with bleeding being cycle day 1, no more than 7 days of bleeding. Almost always, ovulation occurs 14 days before your next cycle. When ovulation occurs, an egg is released from the ovary, and it typically alternates between the ovaries each month. When that egg is released, it only lives for 24 hours before it either dies or gets fertilized. Thankfully, sperm can live in the genital tract for 3 to 5 days. So to optimize each cycle, we recommend timed intercourse at least every other day from a couple of days before, during, and after ovulation. In fact, it's typically sperm in the genital tract before ovulation that results in most pregnancies. I do not recommend ovulation predictor kits in the beginning. If you are having regular monthly cycles, that is generally a clear indication that you are ovulating. We do recommend that you try consistently for at least 1 year if you are younger than the age of 35, and if you are older than the age of 35, no more than 6 months before you consider a fertility evaluation. Now, if you have obvious roadblocks to pregnancy like absent or irregular menstrual cycles, earlier evaluation is warranted. That concludes part 1 of today's discussion. Be sure and join us next week for part 2 of your guide to pregnancy preparation. As always, I appreciate you, take good care, and stay healthy, friends. If you enjoyed today's video and want to see more like it, be sure and follow us at Doc Woodus, that's DOCWOODUS, for all the latest updates. Take good care.